Hello, everyone. Good morning. Welcome, guys. Good morning. Welcome to our last AMA session for 2023, and we're gonna have a lot of tips for hair growth success in 2024. So, a quick reminder that this information is only for educational purposes only, and should not influence any medical decision making. Please reach out to your doctor to discuss the risks and benefits of any treatment before you start. So, welcome to our final AMA. I'm Dr. Behnam, board certified dermatologist. I'm one of the co-founders of Happy Head. Today, we're going to review everything you need to know for your best hair growth results from now until the new year. So, if you haven't started your hair growth journey yet, now is the best time to do it. Hair loss affects about 80 million people in the US, 50% female, about 63% men, 35 plus suffer from hair loss. So Happy Head is the strongest FDA approved prescription medications that's delivered to your door. So our proven formulas are stronger and also are customizable to your needs. So place an order Happy Head also includes free content support from our doctors, and also ongoing customization and just a lot of help. So what are the different types of hair loss? So first of all, the most common one is called androgenetic alopecia. Alopecia is also known as male pattern hair loss or female pattern hair loss. This is the most common type of hair loss and is characterized by gradual thinning of hair, typically starts basically in the frontal hairline or in the crown, or in the case of females, basically on top of the head. Then we have alopecia areata. Alopecia areata is an autoimmune condition that causes patchy hair loss. Typically, usually on the scalp, it also happens on the face, the beard area, the eyebrows. So I actually have alopecia areata, and my twin brother Sean also has alopecia areata, and we both got alopecia areata in 1 week apart.
When?
Almost about 10 years ago, 2013. Then we have telogen effluvium. So this is a type of hair loss that usually occurs when it's triggered by certain traumatic events. So, for example, like a major stressors in your life, illness, surgeries, hospitalization, rapid weight loss, hormonal changes. And what happens is that so usually about 95% of your hair sits in what's called the anagen phase and only 5% the telogen phase. So when you go through that traumatic shock, 50% shift from the anagen to telogen, and that 50% of hair typically falls out. And the description is that a patient comes in and they're like, "Oh, doc, I'm losing like 50% of my hair or 40% of my hair," and you barely touch the hair, and like a chunk comes out. It's usually temporary, but not always, unfortunately. And most of the time, most patients will not going to recoup all the hair that was lost. So one of the most important thing about telogen fluid is to get help right away, because the sooner you stop the shedding, the less you're going to lose. Then we have traction alopecia. So traction is a type of hair loss that's caused by excessive tension or pulling on your hair. It's often due to certain hairstyles that put a lot of stress on your hair follicles. It's commonly seen in patients who wear very tight ponytails or braids or extensions. Sadly, we see this all the time, and the pattern is that patients are losing the hair, kind of going backward like this because you're constantly pulling on the hair. So basically, the front going back like this. Alopecia universalis is a form of alopecia areata where basically you lose the hair all over your body, so scalp, eyebrows, beard, and the rest of the body. And for that one, unfortunately, none of the Happy Head products are going to help you. There's certain other medications that will help you. So it's important to note the specific type of hair loss that you're experiencing can only be really accurately diagnosed by a healthcare professional or board certified dermatologist. And what you do is the dermatologist looks at you, they evaluate your symptoms, your medical history, and sometimes we have to perform certain tests to to really determine the underlying cause of those hair loss. And once we know the cause of the hair loss, then we can recommend the appropriate treatment for you. And this is why basically it's not a one size fit all, because everyone's different. And a Happy Head, we don't have a one size fit all product. Our product customizable based upon your needs, past medical history, and type of hair loss. So, and that's what really sets Happy Head apart from everyone else. So here are a couple questions. So what causes hair loss, and what are the early signs? So again, so the many reasons, again, genetic, hormonal, stress, endocrine like thyroid, what you eat also makes a difference. So if you're a vegetarian and you really don't have a high protein diet, or you're on the other side of the spectrum where you're eating like a lot of the bad protein, like whey protein isolates and doing creatine, so all those will affect your hair. Can hair loss be reversed? Yes, in majority of the time, at times, as long as the hair is not dead, that hair loss could be reversed. So, for example, when somebody comes in and he's completely bald, well, all those hair follicles are already dead. There's nothing that you can really do about it. But if someone comes up, they're just thinning, then a lot of those hairs are probably still there. They're just in a miniaturized state. So by going on some of the happy head products, so for example, like minoxidil and finasteride, it could reverse the miniaturization and cause hair growth. Can it prevent hair loss naturally? Well, yeah, there are a couple of things you could do. Obviously, having a healthy diet is important. So not eating like a lot of processed foods, not doing like a lot of creatine, not doing like a whey protein isolates. Eating healthy obviously is important. We know for sure that smoking is bad for you, alcohol is bad for you. Um, and obviously again avoiding processed foods, that's really critical. But also everyone's different. So like the other day I had a patient who came in and she was like literally 95 pounds. She'll tell you that she won't really eat much at all during the day. She's vegetarian, eats like salads 3 times a day. Believe it or not, those patients don't have a lot of protein uptake, and you need the protein and vitamin D and the iron to really produce um, like the hair follicle, the hair. So having a good, well balanced diet is very important. So what is the most effective treatment for hair loss? So as we know, there are many different reasons for hair loss. So in theory, if you could combine multiple different medications all in one that addresses each one of those factors, that's like the ideal situation. So for example, we know that finasteride is a testosterone blocker that we know, and we know that high DHT could cause hair loss. So finasteride is the main ingredient in the Happy Head products. Minoxidil is another main ingredient. Minoxidil, it actually what it does, it increases blood flow to the scalp, and by doing so, brings nutrients and vitamins and washes out basically the old DHT. So a lot of our products combine the finasteride with minoxidil together. So we have topical products that combine the two together. We also have the added ingredient of retinoic acid and hydrocortisone. And then we also have our super capsules, where we also combine the finasteride and minoxidil together in one pill along with vitamin D, because believe it or not, a lot of patients are deficient in vitamin D and they need the vitamin D basically to help promote better hair growth. So our super capsule combines the finasteride, minoxidil, vitamin D, and our topical combines the finasteride, minoxidil, retinoic acid. The key to anything is about customization. Not everyone is the same. An example I always give is like, let's say if you go to a store and there's only one medium-sized blue shirt for everyone. Well, that's not gonna work. So, and hair is the same way. Everyone's different. We need to customize that. A happy head, we really listen to your history and the type of hair loss you have, and we customize if you're male or female, or if you're busy above a certain age or below a certain age, or the type of hair loss you have, or your past medical history and your allergies. So customization is very important and it's not one size fits all. Also, another key is consistency. So the more you use the products every day, the better results you're going to get. Applying the product consistently will really result in better just hair growth, and usually you see the hair results in about 3 to 6 months. Now, need something stronger. We also have our relatively new dutasteride formulas. So what dutasteride is, so dutasteride is another medication that's similar to finasteride. It's a testosterone blocker, but dutasteride inhibits two enzymes as opposed to only one enzyme that finasteride blocks. In studies, it's been shown that oral dutasteride is superior in blocking DHT. Is actually, I think, blocks about 90% of DHT production, whereas finasteride blocks 70% of DHT production. And as a result, the results are also better. So we have our dutasteride super capsule that combines dutasteride with minoxidil and vitamin D, and we also have our dutasteride topical that combines the dutasteride with minoxidil and retinoic acid. Um, so is hair loss in women different than men? The answer is yes. The pattern of hair loss is different. So usually guys, they're either gonna lose hair from the front and go back or start losing the crown area. Whereas majority of females, they start losing hair on top of the scalp. And also, the medications we use are different as well. So, for men, we typically use the finasteride and minoxidil, whereas for females below age 50, we mainly use minoxidil or spironolactone. Now, if you're a female above age 50, we could also use, finasteride and minoxidil as well. What is the best hair care routine? So if you're applying a topical, it's very important to actually start with a clean scalp. Um, and then basically just rub the put the topical on top and rub it gently all over the scalp. We have a marked pipette, and our recommended dose is to go to zero point 0.5 millimeter and do it twice. So two, like I do a zero point 0.5 in the front, zero point 0.5 in the back, and rub it in and do it twice a day. So you're technically doing 1 ml in the morning and 1 ml at night. What if I'm experiencing hair loss in one specific area? So the answer is that you really want to focus your topical in that one specific area, so you don't necessarily have to put it everywhere. Also, let's say some patients don't want to do a topical and the oral version of the super capsule is perfectly fine as well. What else can I do to strengthen my hair? So obviously, taking supplements is very important. In our own personal clinic, after every hair transplant, we have the patients go on the happiest supplements, and patients really tell us that within a few months, is that they're already starting to see results. The supplements are really important. Our growth supplements have very key ingredients. They include biotin, collagen, keratin, saw palmetto, vitamin A, and vitamin D. And it's honestly great for everyone. Um, Even my wife thinks that she doesn't have hair loss. So now, dermal rolling is also really, really essential. So the way dermal rolling works, at once you apply the topical on your scalp, you want to take a dermal roller and gently basically roll back and forth. So what is the happy head ordering process? So the way it works is that so Happy Head is basically is your online doctor's office. So it's a very similar process to seeing a doctor but in person. So when you go to see a doctor, you have to show your ID to confirm who you are, and the doctor physically examines you. So online is the same way. You have to show your ID to confirm who you are, and also you have to take a photo of your scalp so the doctor could see and evaluate your hair, so they could prescribe and customize the right medication for you. So now we're gonna go our Q&A part. Um, so how long does it take to grow the hair after transplant? And when can I start using Happy Head after hair transplant? So typically after hair transplant, the hair grows in about 6 to 12 months, but you could start using Happy Head after a month of hair transplant. Is it important to put the formula before microneedling or after? Actually, there's really no right or wrong answer, but our recommendation is put the formula first and the microneedle afterwards. And the reason is because when the hair is wet, you can just easily basically microneedle and push the product into the scalp. Um, I think there was also one more question. There was the same person asked two questions actually. So benefits of microneedling before shampooing. Oh, that's a good question. We typically don't recommend that. You could, I think, actually, it's probably better to microneedle after shampooing. How will dutasteride affect my estrogen and testosterone level? So dutasteride, it actually is a very similar effect compared to finasteride. So both dutasteride and finasteride will affect your DHT level, and they will also affect your testosterone level. But the effect, the sexual side effects of both dutasteride and finasteride tend to be the same. What's better, super capsule or topical dutasteride? Well, the answer is basically, that's really individual dependent. The super capsule is great because it combines the dutasteride with the minoxidil, and it's easier to take. The topical dutasteride I think is great, but again, you have to be a patient who's patient about applying the topical on your scalp twice a day. And obviously, the topical potential to have lower risk of sexual side effects compared to the oral. I was wondering about the efficacy of minoxidil over a long period. Will it still be efficacious for you year after year? Can you use it for 10 years and still be effective? But obviously, that answer really depends. Everyone's different. Results varies. I mean, I have patients that took, for example, oral finasteride for 1 year and it stopped working. And I have patients that they're on oral finasteride and it still works. So I think the answer really depends. Is different kind of for everyone. Um, does dermal rolling or snapping create scarring? Typically not. But it also depends. I mean, obviously, if you're using the 1.5 to 2 millimeters like every day and you're really focusing all in one area, yes, there's a risk of scarring. So our recommendation is use a lower depth needle, so like a 0.25, and don't really focus all in one area. Try to kind of spread it out, going back, left, right. Don't just be in one area. Is the risk of many um, is the risk of the needles slicing the hair shafts. Uh, it's unlikely. I mean, it's unlikely. So, and if you really feel that's the risk, you should just get a derma snap and not a derma roller. What do you think of a high frequency devices which create electrical spark when you run the one across your scalp? I really do not know if any of those are effective. There really hasn't been any clinical studies showing the efficacy of any of those products. There are some studies, valid efficacy of LED lights, but even that is not 100%. Given a choice between high frequency and a derma roller, derma snap, what do you think is more effective? I think derma roller is much more effective than those high frequency devices. What do you think about doing a 1 ml of finasteride in the morning and 1 ml of dutasteride at night at both topicals? That's a great question. Look, some people combine like just the way you said, finasteride in the morning and dutasteride at night, and they see really good results. There are also some patients that do oral finasteride 4 times a week and oral dutasteride 3 times a week. There's really no right or wrong answer. There's never been any clinical study evaluating the efficacy of one or the other. We know for sure that finasteride is a stronger molecule, so so it might be better if you just do dutasteride there all the time. But if you want to combine it to finasteride, that's fine as well, as long as you're not having any side effects. If I had a recent hair transplant, how long can I the basic way to begin the topicals? About a month. Using the topicals with derma roller. In the past videos, you used the roller after shower. Do we apply the topical first and then roll? Yes. So use the roller after shower, and then well, yes. This is what I would do. I would shower, and then I would actually apply topical, and then I would derma roll out on top of it. That's how I would do it. Again, there are really no right or wrong answers in any of this, but we believe that if you derma roll afterwards, you're going to see better results. And if you have long hair, remember that sometimes the derma stab might be better, but the happy derma roll is really great. It's very effective. It's very robust and strong, so it's really good. Also, here we go. So let's talk about our conditioners. So people always say, what's the point of a conditioner? Typically, guys ask this question, which is a fair question. Fair question. The whole point of conditioner is, let me give you an analogy. Let's say it's winter and you have really dry skin. So when you have really dry skin, you're more likely to get cuts that don't heal up. But when you moisturize, your skin feels smoother, softer, and it protects your skin against some of the harmful stuff out there. So if you get a cut, you're not going to bleed right away, and it's just going to make it heal a lot faster. Your hair is the same way. You need to moisturize it, and that's what a conditioner is. It moisturizes your hair, gives it a protective coat, and by doing that, it just keeps it healthier. As simple as that. Now, shampoos. There are a lot of shampoos out there, and no one is saying that shampoo is gonna, it's really like it's magical. But in conjunction with the oral and topical medications, it will help you. Our shampoo is very different. It's a biotin keratin shampoo, which means you have a lot of biotin in it. Keratin, saw palmetto. It's sulfate free, paraben free, obviously cruelty free. We didn't kill any rabbits making this product. So overall, really great shampoo. I use it all the time. My son uses it. I should bring a photo of my son using this product. It's really good. So overall, really great shampoo. And honestly, I'll tell you, the most important one is the vitamin. The vitamin is really key. You have to realize that your body needs certain vitamins. And although we live in LA and it's sunny 24/7, basically like year round, the problem is that there's some patients that still don't have enough vitamin D. And how do I know? I check labs all the time and I see it. So, here, I want to open it for you. Oh, still not open. This is good. So basically, our happy vitamin is really important because it contains vitamin D, a good amount of biotin, vitamin A. It also has collagen, biotin, saw palmetto, and just overall, really good product. And you take basically 2 capsules in the morning and 2 capsules at night, and it really does help quite a bit. Are there foods that we should eat that we can eat that will help promote hair growth? Very good question. So, having a well balanced diet is very important. So, for example, eating products that are high in protein, so avocados, cashews, nuts, those are really, really key. Um, Again, just more protein. Like chicken is great, but then you really want to try to stay with the organic pasture-raised chicken, not the non-organic ones. Obviously, staying away from things like hot dogs, like processed foods. Those are all horrible. Creatine, whey protein isolates. When patients come in and they're not taking like a lot of protein, I'll always say, go to Whole Foods, buy a vegan protein or a whey protein concentrate, and also buy collagen powder like Vital Proteins. Mix the two together, make a smoothie, and drink every day. I highly recommend that for patients that are basically they don't have a very good diet or that they don't take a lot of proteins or sometimes older patients like above the age 60 or 65. Those are really important. So a good well balanced protein diet is really important. Also supplementing your diet with vitamin D and iron is also very key. I always say these are the four pillars of hair loss. um, Whey protein, collagen, dermal roller, and your vitamin D and iron. Very important. Guys don't have to take the iron, but for females, it's very important to take iron. But guys should definitely take vitamin D. Um, let's see. Upcoming products. Perfect. So in 2024, so we have introduced our dutasteride formulas, and again, dutasteride is a medication. It's very similar to finasteride, but in clinical studies, it's been shown to be a lot more effective. So we believe that dutasteride is where like a lot of patients could shine and really have basically great hair. So we're encouraging our patients basically to look into in our topical dutasteride as well as our oral dutasteride. Also, we are coming up with another medication, combo medication. We're not going to mention it yet, but this combo of drug could actually potentially reduce your sexual side effects from taking the oral finasteride. So we are super excited about it. It is not released yet, but we should release it soon in the coming weeks. Well, I think this was Ed. Thank you so much for having us today. If you're considering to try Happy Ed, please use the code AskDrBen60 for 60% off your first order. And also, uh, your comments are really important and your reviews are really important for us. And we really, really encourage you guys just to get on Trustpilot and rate us. We really appreciate it. And I wish you guys a happy new year and happy holidays with great hair. And we're going to see you in 2024. And thank you for all the staff at Happy Ed to make all this possible as well. Thank you so much. Bye, everyone.